Welcome back, everybody. Welcome back to a brand new video. Today's another health video called headaches in random order. These are not serious not serious to not serious or in any order. Oh my gosh. I meant to say not serious to serious in any order. So that means we'll have headaches that are worse than the other ones. So, these are in random order because recently, I've had headaches for a couple years daily right now. But the thing is, that's really cool, is today's video is actually going to be pretty long. And some of these headaches we already talked about and has symptoms you never even thought you had with these headaches. So, or maybe you did. But again, I'm not a real health doctor, so if you think you have one of these and they're one of the serious ones, I would go to your doctors and get it checked out, because I'm just a kid sitting on his kitchen table trying to make a good video. And I don't think you're really going to get much out of that. But anyway, let's get right to it. So, let's get to all of the headaches. These might be, I don't know if these are in the exact right order. I don't know if one headache is more serious than the other, but I do know that these are all the type of headaches you could get. Now, yes, there is a lot about the world we have yet to discover, which, heck, could even be headaches we haven't even discovered yet. So, if you have one and they discover a new headache, well, you might just be rich. But anyway, here we go. So, we have the most painful headache, aka the Thunderclap headache. So what this headache is, a severe headache that reaches its maximum intensity very rapidly after onset, which can be a symptom of number of serious medical conditions, typically involving the vascular system of the brain, such as a stroke. So a stroke can cause a thunderclap headache. So thunderclap headaches are usually caused by, serious damage to your brain, which can be bleeding inside the brain. So if you have bleeding in the brain and you don't know and you have one of these headaches and it's like an onset, like it's not a typical headache that, like a migraine, you have an aura to it. You don't have this with this. This comes on suddenly, which means it doesn't give you a warning, which means it doesn't come on gradually. It comes on without a warning, which means if you were to have this headache, you wouldn't have this headache hurts a little bit, and then all of a sudden it gets worse. That could be a migraine. Alright, but this headache in particular, it's worse, alright? It gets even worse in the maximum of 60 seconds. So, that's the thing though. You don't know, alright, when you're going to have one of these. These are typically very, very rare in children, and in adults, they're not that rare, but they are still I wouldn't say very rare, but they are kind of uncommon for adults. This headache in particular is not good and is not common. I don't even think you can have this. My nose is stuffed up. I don't think you can have this without one. So yeah. But I do know that thunderclap headaches do indicate bleeding inside the brain. So that could be from a hit, from trauma, from, maybe a brain aneurysm can cause bleeding in the brain because it's an aneurysm and it's a blood vessel that pops. And yeah. So thunderclap headache symptoms. We did this video yesterday, so if you want to check that out before you watch this video, it'll tell you everything. So this is already stuff you should know if you already watched that. Thunderclap headache symptoms strike suddenly and severely, peaks within 60 seconds, and can be accompanied by nausea or vomiting. So again, you have nausea or vomiting with a headache. Again, it's not always going to be that. I said it's rare in children, so if you're a child, you're not going to always have these, okay? These aren't some, you're going to have all the time. Because again, they haven't really came up with a cause for these. All right, that's like a real big cause. But of course, they came up with a cause saying it's from a brain aneurysm or a blood, bleeding in the brain. But these can even happen without a reasoning. So yeah, although they might be freak you out and might be scary and terrifying. I could just imagine. I hope I never have one. These freak me the heck out, as much as cancer does. Holy crap. But yeah. So, in severe cases, I don't know if I spelled severe right, but it may also include in severe cases altered mental state, which means their mental state is altered, which means it's not normal of a mental state. They're not acting right. It can also include fever and a seizure. So again, any headache with a seizure could indicate this or something far worse. That's more, I wouldn't say far worse, but it would be more serious because it could kill you faster. But I told you, kids or adults with seizures is a big deal. So is for kids because, kids can have really bad brain damage. I mean, adults can too, but kids have a less brain, less of one that's already everyone has a brain, but there has yet to fully develop. So it could cause far worse side effects in the long term way. Thunderclap headache causes. There's no obvious cause for some thunderclap. There we go. That helps clear your nostrils. So there's no obvious cause for some thunderclap headaches. In other cases, a variety of potential life-threatening conditions may be responsible, including bleeding between the brain and membranes covering the brain, some carotenoid hemorrhage, a rupture of a blood vessel in the brain, a tear in the lining of an artery that supplies blood to the brain, leaking of the cerebrospinal fluid, usually due to a tear of the covering around a nerve root in the spine, death of tissue or bleeding in the pituitary gland, a blood clot in the brain, severe elevation in blood pressure, hypertensive crisis, and infections such as meningitis or influengitis and ischemic stroke. So again, I think even blood clot in the brain is very, very serious. It needs treatment immediately, surgery. But here's the thing. Blood clot in the lungs is already dangerous enough, and the chances of you making it with a blood clot in the lungs and not dying from it is very slim. Because blood clot in the lungs are very important. They help us breathe, they help us keep our body safe and functioning. Without our lungs, we're dead. And same thing with brain. With our brain tells us to punch, kick, everything, like I said in the video. But yeah, even tells you to say cake farts. Anyway, I don't know why I said that. That's a very inappropriate thing. I'm sorry. But anyway. But yeah. So again, it's bleeding between the brain. So it can be from a brain aneurysm. Because brain aneurysm is like a bulging vein in your head. So basically your brain has veins and has arteries. And if there's a big bulge in one of them, and that's a brain aneurysm. That causes bleeding inside the brain. And that can be very, very life-threatening too. And the thing is, having one of those, you could have a brain aneurysm right now as we speak, but then whenever they rupture, that's when you first hear them. There could be a brain aneurysm and a ruptured brain aneurysm. A ruptured one is when you actually find out you have them, because in order to find out, you would have to have a scan of your brain. I forget what those are called. Brain scans or whatever they're called. I'm pretty sure you have to get a scan of your brain. Of course you need a scan of your brain to find out if you have that specific thing or not. But yeah, they could go unnoticed until they eventually rupture, and that's when they could might be too late by then. Because brain aneurysms have a way of going unnoticed, which means they could go unnoticed even, I don't want to say after it, but before any of it happens. So the dangerous thing about, brain aneurysms is they could go unnoticed without, any symptoms. But then whenever they ruptures, that's when. And by that time, it might be too late. So that's what makes brain aneurysm, in my opinion, a little bit too late, a little bit too dangerous for everybody. So, severe elevation in blood pressure, infections such as meningitis there could be meningitis and bacterial meningitis, which, again, I talked about Morg's mom. She didn't die. Why did I say that? Oops, I meant she almost died from meningitis. If a couple hours later she would have not gotten the treatment she needed, and she would have died. So meningitis is something I don't think a lot of people take serious, just like thunderclap headaches are not taken serious, as well as an eruption intestine. In my opinion, I think none of these conditions on here actually are really that well, examined, in my opinion. I'm not a scientist, I don't know, but I'm saying scientists are probably one of the world's most hard-hearted people ever, and I am so thankful for having them, because without them, I think we would have viruses we wouldn't even know how to get rid of. But, yeah, Thank you, nurses. Thank you, policemen. Thank you, everybody that helps this world out. Thank you so much. I love all y'all. Even the people that watch this and subscribe. Even the haters. You know, you gotta love everybody. Like God wanted you to. But meningitis can cause that motherfucking explosion. But yeah. 2. It's a cluster headache. This headache is actually far worse than any migraine. Yes, it's true. Cluster headaches are actually far worse than any migraine ever. Alright, cluster headaches are like the most that's common. More less dangerous than a thunderclap headache, of course. But cluster headaches are one of the world. It's the second world's, I think. Well, I'm not going to say second, but on this list, it's the second most painful headache ever. If you have had a migraine, which I thank God I never did. Thank God, make sure I don't tonight or never. Migraines are fucking painful. Holy shit. I saw some girl at my school have it. Holy fuck, do those things are painful. But a cluster headache is extremely... they're extremely. So yeah. 1 is a cluster headache. Cluster headaches tend to strike in groups, hence the name, and they only affect one side of the head. On the side being affected, the eyelid droops, the eye tears, the pupil becomes smaller, and the nostril runs. Cluster headaches also affect men 3 to 4 times more often than women, according to Loader. Now here's the thing. What's really cool about these two interesting ones, cluster headaches happen 3 to 4 times in men, and the migraine, I don't know if they happen 3 or 4 times more than women, but they happen, like cluster headaches happen more in men, and migraines happen more in women than men, and, you know, cluster headaches happen in more men than women, which is a really cool thing. I wouldn't say it's very cool, but it's very interesting to know some of these are like that. So yeah, as the pain, it's really, really bad. Cluster headaches are noticeably severe to the point where patients often can't control themselves during a headache. They may bang their head, pace the room, or become violent. Loader explodes. A long time ago, I wrote an article about medical legal consequences of cluster headaches, and they are some very interesting. So I took this off a website, so thank you for this website for making this possible. But yeah, cluster headache symptoms. Unliteral pain, pain in one eye, pain that radiates to the jaw, swelling in the affected eye, tearing, runny or blocked nose, eye redness on the affected eye, facial sweating. The bouts of pain can occur 1 to 8 times in a day. So just imagine you're having one of the world's worst headaches 1 to 8 times a day. That is fucking wow. Oh wait, that's insane. Think about it. You have a headache like this 1 to 8 times a day. That could be throughout your entire day. Your entire day is going to be ruined. So, the cluster headaches causes. The case is unknown. Changes in hypothalamus may play a role. Factors that influence cluster headaches include allergens, allergy causing substances, stress, seasonal changes that occur in spring or autumn, male sex hormone variations, occasional head trauma. The risk factors include gender. Men are more likely to develop cluster headaches. Age. People between the ages 20 and 50 are at high risk. So if you're ages 20 to 50, again, you're not always promised to have this, but it is, you know what, you're at a high risk. So that's most likely it's more likely you have them than you won't. In a way, I guess. Family history. So family history, if you have this, it's most likely going to be genetic, which means it runs in your blood, and you most likely will have it through that. So smoking. Now, smoking isn't the only thing that could, smoking is not, this is not the only thing smoking could cause. It's called collapsed lung, death, COPD, let me think, emphysema, or maybe not, I don't know. Alcohol. So drinking alcohol can also cause this. Alcohol can cause any shit. Really, I've seen it happen to my dad. He's dead, thank God. Anyway, are cluster headaches serious? Not really. They can be caused by other medical conditions, though. So if you think you might have this, it might not necessarily be caused by nothing. It could be caused by medical conditions. So, they say there's no literal cause. But again, I guess you could kind of consider medical conditions I guess you could call allergens or any of these really that, but I don't know. 3. Migraine headaches. A migraine is a headache that can cause severe throbbing pain or pulsing sensation, usually on one side of the head. So if you want pain on one side of the head, again, it could be really any headache on this list, except Thunderclap headache, because that's like the worst headache of your life. But of course, it can happen on one side only. So I think it's more likely. I have headaches a lot, so I look them up to see if it's a migraine, because any day now I could have one. You never know. It depends on how anything is anymore. I stress myself out a lot, so fuck. I could end up having my first one on fucking Mondays. So usually on one side of the head, I think it's most likely going to be on your right side of your head, than on your left. I think there's a whole different type of headache that is on the left. I think that's like a cluster headache. So cluster headaches and migraines are the two most painful headaches that are pretty common to get, and they all have one side of their head that you could get them on. Now again, I think you could possibly get these anywhere on your head, not just one spot. So you could have these, I think, multiple. In my opinion, I think you could have these multiple spots. Because again, how do your body know what side it's on? I don't know, bro. So a migraine is a headache that can cause severe throbbing. We already said that. Migraine symptoms include nausea, vomiting, sensitivity to light or sound, visual effects, and aura. So an aura is something that you're gonna have before a migraine. So there are different type of stages, I think, before a migraine happens. But an aura basically messes around with your vision and what you see. It can cause hallucinations. It can basically cause mostly, I wouldn't say everything, but a lot of stuff for an aura. That is already uncomfortable, but that's, I think, giving you a warning sign. Your migraine is coming on. You gotta do something about it. I mean, migraines, I really don't know. I mean, you could probably take some medicine to keep them down. I mean, I'm pretty sure doctors have come up with migraine, medicine. But if not, just get some rest and go in a quiet room. Because migraines, you basically cannot have any sound on. So that's photophobia, which photophobia means your sensitivity to light, and sound is phonophobia, I think. There's two phobias, and I know for sure photophobia is sensitivity to light. Now, sound, on the other hand, I think it's phonophobia. If I'm mistaken, I'm sorry. But, again, it can mess with your vision. So here it is. What are auras of migraines? Including temporary visual or other disturbances that usually strike before other migraine symptoms, such as intense head pain, nausea, and sensitivity to light and sound. So this is something you can also see. Now again, this is off of Google. So I don't really know if you would have this. Here's the thing: I don't really know if you would have this, because a thing about an era is how does a computer actually see it? I mean, there might be some other ways I don't know. I mean, anything's really possible, but I don't think necessarily you would be able to see it on a computer screen. But again, I think this is edited to make it look like what it could look like. I don't know. And this is how it really looks like. Just look out for this in your vision. I mean, you shouldn't be going on the road if you're having a migraine. If you do and you see this, you just pull over. Because you might actually get into a car accident. Because how can you see well, Migraines are not something to joke around about. Motor auras. Slurred or jumbled speech, difficulty understanding what others say, difficulty writing, problems thinking clearly, visual errors, flashing lights, zigzagging lines, blurred vision, blind spots that expand over time, sensory errors, numbness or tingling. So this is where the motor errors would be, the eyes, visual. So we see flash zigzagging lines. So this actually might be correct. Thanks to Google for the slide and pics, and thanks to Medical News Today for it also. What causes migraines? Though migraines causes aren't fully understood, genetics and environmental factors appear to play a role. Changes in the brainstem and its interactions with the trigeminal nerve, a major pain pathway might be involved. So again, any of this, like your brain basically tells you to do anything, and your head is, in your brain. Your brain is inside your head. And that could cause, some really bad stuff too. Now, not every headache is going to be one of these. I mean, the most common one we're going to get to in a little bit. So, can migraines cause dehydration? You need hydration. That keeps your kidneys running, your every single organ of yours. You have to have water. Your body will not function right. Alright? Your kidneys, I'm pretty sure, are in the back right here. You got 2 kidneys, your left kidney, your right kidney, and your kidneys help fluid out the water. So basically, if you don't pee a lot or you see a different color of pee, that can also indicate something serious. So like brown, I think, means kidney failure, kidney something. Now, I'm not going to say this to alarm anyone, but you could potentially have dehydration from a migraine, which can lead to other complications because, again, if you don't get hydrated. So I'm pretty sure I know what would cause dehydration in migraines because my foot is cramping on me, and I hate goddamn cramps. Goddamn. So yeah. So sorry, I don't know what I'm doing anymore. So. He would actually die. Hiccups, darn. I continue. So yeah, migraines, I think why they cause dehydration is because you vomit. And vomiting basically just takes out all the fluids in you. Because the fluids basically go out with the vomit. So basically you're vomiting, you lose all your fluids, which means you would have to hydrate again. Which you gotta give yourself some time after you vomit so you don't actually vomit out more fluid that you put in yourself. Because again, you could throw up, anytime, really. You could throw up like a minute after, 20 seconds after, any really time you could throw up after. So yes, it can play a role in causing and being caused. So again, so basically, dehydration can cause a migraine. And it can also be caused by a migraine. And I'm pretty sure the reason is, in my opinion, because you throw up and that's how you lose fluid. But again, I think any really big headache, I don't know if migraine can cause hyperhidrosis, which is like excessive sweating. But if it can, sweating can sometimes lead to dehydration. Not always, but sometimes. Ice pick headaches are the next one. Ice pick headaches are a type of headache disorder that can cause unexpected sharp stabbing pains. Primary stabbing headaches have no underlying cause. They're difficult to treat because the pain lasts just a few seconds. So it's kind of hard if you have one. I'm very sorry for you. These are goddamn painful. But ice pick, hit the fucking name. Ice pick. It's like your eye is being stabbed in that. You're basically, it's like a pain that you're getting stabbed in the eye with an ice pick. So it can be very, very serious too. Not saying it's just the pain can be serious. It's not usually going to cause death. But it is a very serious headache when it comes to the pain level. But they're not as bad as a migraine or it's not as bad as a migraine or any of those other headaches, but it is still a very bad headache. They're difficult to treat because the pain just lasts a few seconds. So in order for you to really be treated for something, it usually needs to last a few minutes or a few seconds. I wouldn't say a few seconds, but a few minutes, so they can know what the causing is. Because if they don't find out what the causing is, it could get a lot worse. Headaches, yeah. Ice pick headache symptoms. Symptoms: if you have experienced an ice pick headache, you may have felt an intensely sharp jabbing sensation around often your eye or temple area. So if you have pain in your temple area, that can also be caused by optical neuralgia. I don't even know how you say that. Which we'll talk about that a whole separate video. This is already going to be a long one, and I like to keep them short and stiff. But again, I want to include all the ones, but this one I'm going to wait for another whole video. But symptoms: if you experience an ice pick headache, you may feel an intensely sharp stabbing sensation often around your eye or temple area. I said that again just because I wanted to and because I keep forgetting. I'm not in the best mental state right now, bro. I'm tired. I keep making mistakes, man. I came back from a church thing, which I should be happy, which I am, but I'm tired, man. I get no freaking sleep, bro. I gotta wake up at 6 o'clock tomorrow like I do every damn day. When I don't have to, but tomorrow I have to because school is happening. But yeah, symptoms, if I'm not reading that again. So often around your eye or temple area. So like around your eye, also it could be a tension headache because it can feel and we'll get to what that is. I don't want to keep spoiling everything. But a temple area, this can also be caused by an ice pick headache. Now, these really I don't think can cause any big symptoms really, like vomiting or anything, because they just last a few seconds. I mean, I don't know if this can really cause like a butterfly feeling in your stomach though, because it only lasts a few seconds. So I feel like for a headache to really cause vomiting would have to be one that stays there, and it's just there. It doesn't go away. But ice pick headaches, the really good and relieving part about it is it doesn't stay there forever. It just goes for a few seconds and then it out the damn door. So linked to migraines and cluster headaches. It's interesting to note that some people with ice pick headaches report that their headaches begin with or worsen by exposure to bright. So it says, I think it's basically linked to migraines and cluster headaches. So these all three are basically a whole family in my opinion, because migraines are damn painful as hell. Cluster headaches are even more painful as hell, and ice pick headaches are as painful as hell as, just any headache really. I mean, ice pick headaches are not to joke about. Migraines are hell not to joke about. Cluster headaches are definitely not the fuck to joke about. So in this entire family, I think cluster headaches would be the dad, and the migraines would be the mom, and the ice pick headaches would be the son. I remember there's this big buff family that causes these worst pains of headaches. That's how I look at it. Or that's how I came up to look at it. I mean, you really can't help these causes or help if you have these. But again, So what is a sinus headache? So sinus headaches are usually associated with a migraine. So I call this the sister of those three. Or other forms of headaches. So again, a sinus headache is basically going to be caused by sinuses, so like allergic reaction. I won't say allergic reaction, but allergies to like pollen and stuff. So it ain't a serious one. Sinus headaches might be painful because like you can't touch anything, your face fucking hurts as hell. And sinus headaches are usually associated with migraines or other forms of headaches. Sinus headaches are associated with pain and pressure in the face, and sinuses can cause nasal symptoms. Most of these headaches are not caused by sinus infections and generally should not be treated with antibiotics. Again, these only need, these headaches will go away. They're not ones that you have to go to the ER immediately because, oh my gosh, I think there's something wrong with me. They're not going to be like that. They might be, pretty uncomfortable and pretty frightening because, there's pressure in the face. You're thinking, oh gosh, my brain's exploding. But again, that's not true. But sinus headache symptoms: feeling pressure in the face and forehead, pain that worsens when moving the head, and a blocked nose. So again, a blocked nose can also cause this, and you're not always promised to have these headaches, okay? We're going to get to the most common headache to get in the next one, so here we go. What are the preventions of this headache? Was found on www.mayoclinic.com. Avoided triggers. If certain food or odors seem to have triggered your headaches in the past, avoid them. Your provider may recommend you reduce your caffeine and alcohol intake and avoid tobacco. In general, establish a daily routine with regular sleep patterns and regular meals. In addition, to try to control stress. So again, stresses can also cause sinus headaches and much more. So again, tobacco can also cause these, alcohol can cause these, caffeine can cause these. I mean, caffeine isn't the worst thing to have. It can sometimes make you feel good or make you feel sick, depends on how much you fucking eat or drink. But yeah. So exercise regularly. Regular aerobic exercise reduces tension and can help prevent headaches. If your provider agrees, choose an aerobic exercise you enjoy, including walking, swimming, cycling. Warm up slowly, however, because sudden intense exercise can cause headaches. Obesity is also thought to be a factor in headaches, and regular exercise can help you maintain a healthy weight or lose weight. So reduce the effects of estrogen. If estrogen seems to trigger or make your headaches worse, I don't know if this is an inappropriate word. I'm sorry, but I'm just reading what I found on the internet. If estrogen seems to trigger or make your headaches worse, you may want to avoid or reduce the medications you take to contain estrogen. These medicines include Are you kidding me? You know what to read. I ain't reading that shit. What are tension headaches? Tension headaches are known as stress headaches. So these can be caused by stress. These are the most harmless fucking headaches of your entire life. Tension headaches, also known as stress headache or tension type headache, is the most common type of primary headache. The pain can radiate from the lower back of the head, the neck, and eyes. So I always have them around my eyes, and they are pain. So I just call them tension headaches because I don't have migraines because they're very uncommon to have later on in life. You mainly get them like when you're a child, and they continue with them. What the symptoms? Dull and ache and head pain, tenderness on the neck and shoulder muscles, tightness or pressure sensations around the forehead. Can you throw up from tension headaches? They don't typically cause vomiting or nausea and sensitivity to light, so they do not cause any of that. Tension headaches causes. It is thought to be triggered by physical and emotional stress, including head injury and anxiety. Can you have a tension headache with a head injury? Yes, but it has to here's the thing though. I'm going to spit this goddamn thing out because we all need to know it. I feel like a lot of people take head injuries a little bit too seriously. I know I'm getting a lot of hate from doctors and from people who fucking worry their ass off like me. I intentionally think yes, okay? I typically think that yes, this can cause it because, I mean, come on. It says it there, it's true, Google knows what they're talking about. But it has to be a hard hit. I feel like, alright, say I hit my head off this door right now. Like this, right? Oh no, I have a concussion because I hit my head off the door. No. Alright, just the littlest hit, like this. Oh no, I have a concussion now. It's not like that. You have to hit it so hard off something. Your skull is one of the strongest parts of your body. So how can a little hit to a door and to any hit to the head really cause any damage? It has to be one of the biggest hits you've ever had in your life, like a car accident, hitting it off metal real hard, hitting it off a wall, falling down the stairs like what Pap did before. Long story short, and much more. You cannot get a head because I did this. Oh no, I have a concussion. That's not true. You don't get a concussion from any of that. You have to hit your head off something very extremely hard in order to have a migraine. Migraine, oh my gosh, I meant a head injury. So you cannot have a head injury just because you hit your head off something, because it has to be a hard hit. So yes, but it has to be a hard hit to the head to even cause any bad damage or even a little damage to your skull. Your skull is one of the strongest parts of your body, so one little bumper hit cannot cause a head injury or concussion. Now yes, I'm not a doctor like I say every damn video I do of these. I don't know. This I 100% do I think I know. I 100% think I do know that these cannot cause it. But again, that's not always a possibility. Alright? Yes. Okay, maybe your brain isn't really fully developed. You've hit it before and it can cause it. But again, I told you have to hit it extremely hard off something. If you hit it slightly, you can't do anything. So it really can't do anything. Thank you for watching. Subscribe, like, and comment. Let me know what your favorite part of the video was, and I'll see you guys on the next one, which is going to be water intoxication. Goodbye. Wait, can you get on my ice cream now? Because I want it. Gifts or whatever.